The head of the NHS in England says that hundreds of thousands of people could be suffering the effects of what is now known as long COVID.
That's people who haven't necessarily been hospitalised with COVID-19 or spent time on a ventilator in intensive care, but are nevertheless struggling to fully recover.
Long COVID may not be just one syndrome, but up to 4, including permanent organ damage, complications after intensive care, post-viral fatigue syndrome, and continuing COVID-19 symptoms.
Post-viral fatigue is extremely common after viral infections. It normally resolves in a matter of a few weeks at most. When that doesn't really go away, and there are other symptoms as well, you're continuing to feel virally, you may have sleep disturbance, you may have a bit of cognitive dysfunction. Plus, it's really having some significant effect on your normal life. Then I think you need to be thinking about, is this a post-viral fatigue syndrome? And again, if that is managed sensibly, in most cases that resolves itself.
There's no surprise that people are developing post-viral fatigue syndromes after this particular infection. We know that coronavirus in the past, SARS infection, around about 10% of people went on to develop an ME/CFS-like illness.
And we know that in around about 75% of cases, people will predate the onset of their ME to a very clear-cut infective episode. They will describe an infection. It may be something quite straightforward, like a flu-like illness, a respiratory tract infection. It may be rather more specific, like glandular fever or chickenpox. And they will say, I got that infection and I never recovered from that infection.
I think the cardinal parts of the illness are what's called post-exertional malaise, where any kind of effort, physical but also mental, makes all of the symptoms worse, typically about 12 to 48 hours afterwards.
When you look at the patient perspective, post-exertional malaise is described as a debilitating crash following minimal exertion that can take weeks to recover from.
So in fact, one of the diagnostic criteria for this disease is post-exertional malaise or post-exertional intolerance. So that if you do exercise, you get worse. That's a diagnostic criteria.
One of the first things this physician should do is stop telling the patient to go exercise. This is one disease you cannot exercise. If the patient's telling you, if I went out to walk 2 blocks and I would basically be in bed for a week, and the patient was a marathon runner 10 years before, I think we'll be a little foolish telling the patient to go exercise.
I had to walk, and you had to increase walking by 10% each week. And as I began to get sicker and sicker, I was told, this is the moment where you push through and you get better. I started the clinic being able to walk about 4 minutes each day. I ended and I needed a wheelchair.
NICE have reviewed the evidence for graded exercise therapy and found it to be low or very low quality. New biomedical evidence and NICE commissioned patient surveys have led the new draft guidelines to warn: do not offer people with ME/CFS any therapy based on exercise, generalised physical activity or exercise programmes, or even specialised graded exercise therapy, as this is showing harm to patients.
The most important, I think, initial advice for people with long COVID is to get this activity management correct, because one is hearing so many stories of people with long COVID. They're feeling a little bit better, they're going out for a run, and then they're crashing immediately after that.
So our advice for physios working with people with COVID-19 would be to watch out for these delayed responses to exertion, whether it's physical or mental exertion, that can trigger their post-exertional malaise. And if you see signs of this, then possibly your patient is developing ME. And people with ME have stated that they wish in this early stage they were told to rest, sleep, avoid symptoms, and use symptom contingent pacing. And we know that people with severe and very severe ME have also said that pushing exercise at this stage actually pushed them into severe ME.
First law should be to do no harm, to not make the condition worse by allowing the patient or pressurising the patient to do too much.
So what we would advise patients with this illness to do is to pace their activities so that they are not exceeding their limitations. They are dividing their physical and their mental activities into little small chunks. What is important not to do is to push on to the point of physical exhaustion and fatigue, because then you are just going to get a prolonged period when you're not going to be able to do anything because of this symptom of post-exertional malaise.